talking to Dr. Hugh MacLeod, who was Registrar of the College of Physicians from 1968 to 1981. We're in the new library of the college, and it's the 20th of January 1997. Where were you born?
I was born in Dornoch in Sutherlandshire.
Right. And from what we were saying earlier, this is not a Gaelic speaking.
No, sadly it isn't. There used to be a bit of Gaelic spoken on the east coast, but mainly in the fishing villages, Vembo and Golspie, Brora, Helmsdale, but not curiously enough in Dornoch itself.
Right. Were your parents Gaelic speaking, or were they from Dornoch?
My mother was actually a fluent Gaelic speaker, but my father wasn't.
Right.
And consequently it was never spoken in the home. Right. Which I now regret, having taken an interest late on in life in the language.
Did your mother miss speaking Gaelic, do you think? Do you think it was a sadness to her?
I suspect it was.
Yes, but mums are not allowed to say that, are they?
That's right.
Yes. And what did your father do?
Father was a police officer.
Was he? Mm. Yes. And where did your mum come from?
She came from the Dornoch area.
Right.
Yes.
And where did you go to school?
Dornoch Academy.
Dornoch Academy. And did you go right through Dornoch Academy?
Yes.
Right. And what subjects did you do at school?
Oh, gracious. It's a long time ago.
Right.
English, French, Latin, mathematics, science, history.
Right. Was it a good school?
Oh, very good school, yes.
Do you still have contact with people with whom you were at school?
One or two, yes, one or two.
And were you a shinty player, or?
No, I wasn't. Shinty wasn't played. Again, that was not a game that was played on the East Coast.
Right.
It was played in the islands and further down the west coast of the mainland.
Right.
But not on the East Coast.
Right. And at what stage did you decide that you wanted to do medicine?
Curiously enough, from a relatively early stage. I remember the local doctor first interested me in medicine. I was most impressed with him. He was an impressive character, actually. And he it was who, as it were, fired my imagination that this would be a very good career to follow. And I fixed on it, and so it was.
Yes. Do you have brothers and sisters?
No, I was an only child.
Right. Do you think your mum also intercalated the idea of doing medicine? Do you think that?
Well, I think she was not averse to it, shall we say.
Yes. And then, did you do well at school?
Did I
do well at school?
Yes, I was fairly well up in the class,
yes. And then where did you go to medical school?
Edinburgh.
And was the local doctor from Edinburgh? Or?
He wasn't, no, he was actually from Glasgow.
Right.
But I had an aunt and uncle in Edinburgh, and they wanted me to stay with them, and this, of course, was very convenient and very suitable. And that was really the main reason for choosing Edinburgh.
Oh, interesting. And was coming down to Edinburgh quite a change in style?
Oh, my word, yes.
What were the things?
Yes. Yes, a greenhorn from the north.
Is it?
Really
what year did you come to Edinburgh?
Pardon?
What year did you come to
1942.
Edinburgh? Right. Now that would be quite a difficult time in Edinburgh. And
it was.
Did you fish? Were you a fisherman at home? Were you a fisherman at home?
I was a golfer.
Right.
But no, I wasn't a fisherman. That's perhaps rather surprising in a way that I wasn't. But I don't know, I never fancied fishing very much. Of course, the Dornoch golf course was close by, and as you probably know, it's a world famous course.
Yes.
And most of the young lads in Dornoch at that time played golf.
Right.
And it was great fun.
Do you still play golf?
I do, yes.
Right.
Play at it now rather than play it.
Yes. And you came here, and Did you do first year? I mean, it was an abbreviated course, was it not, during the war? Was it not speeded up?
6 years.
6 years,
Yeah,
right.
6 years.
So who taught you in your first year?
Well, in the first year we did anatomy, of course, and physiology. Anatomy, E.B. Jameson,
Right.
and Professor Brash. Physiology, Ivan de Berg-Daly, whom we never saw, actually, in the war. But he was the professor. It was a man called Howells, if I remember rightly, who was the senior lecturer. And, of course, we had Professor Gaddam in pharmacology. Who else did we have? Professor Ritchie, zoology.
Yes.
He was a marvellous lecturer, by the way.
Was this up at King's Buildings that you went?
He was one of the best lecturers, I think, we had in the course.
Yes. What was so good about him?
Clear delivery, and he always supplied us with a little summary of his lecture. Absolutely first class for revising, you know.
Yes.
Really was very good. But he was a most interesting lecturer.
Were the big years then?
Pardon?
Were the years big in those days?
Yes, there would have been 120, 130
Yes.
on my year, something like that.
Yes. Was the war hanging over you?
Yes, very much so. I mean, I think most of us were very much aware that it was a great privilege that we had to be allowed to continue our studies while men of our age were away fighting.
Yes.
And it concentrated the mind very powerfully.
Yes.
I suppose in some ways it rather marred the enjoyment of university life, because you felt compelled to really get on with it.
Yes.
There was no room for idling or enjoying yourself too much in various diversions.
Right.
You really had to concentrate on your studies, and it was all very sobering, really.
Yes.
Would be the word.
What was E.B. Jameson like?
Oh, he was a droll sort of character. I always remember he used to, in the first year, after the New Year, in that first term after the New Year, he always did the anatomy of the abdomen. And he came in and he didn't look up at the class at all. He just looked down at his lectern and he said, Happy New Year abdomen. The abdomen is divided into two parts, the abdomen proper and the pelvis. And that was the New Year greeting.
What was he like in the anatomy dissecting room?
He was very good and very considerate and very kind to the lesser mortals who weren't so adept at dissecting as he was.
Yes.
And he very seldom scolded you.
Uh-huh.
The worst I've heard him say was somebody has using the knife too carelessly or too much.
Right.
But that was about the strongest of his rebukes.
That must have been quite a wonderful experience to a gash lad coming down from Dornoch to meet someone great like that.
Oh yes, he was
in
a
daily
marvellous
basis.
man.
Yes.
Marvellous man. He had a fantastic memory too.
Yes.
I mean, you meet somebody on the year whose father had been in medicine through Edinburgh,
Yes.
and he would remember about him.
Yes.
Tell the boy about his father and some of his mistakes and mishaps and so on.
Yes.
Yes, he had a fantastic memory. And of course, Jimmy's diagrams were quite beautiful.
Yes.
He was a very gifted artist. He was a very fine man. I had a great respect for him.
Did you go on these trips to Shetland or?
No, I didn't.
You didn't get invited?
It was mostly the boys who stayed in Ramsey Lodge
Right.
who went on that particular excursion.
Right.
You know, the place up at the top of the mountain.
Yes. The place where they had the catapult with the rotten vegetables into one state.
Yeah.
It's for Princess Street. And did Brash appear much? Was he...
Oh yes, Brash was, he wasn't quite as colourful a character as Jameson, but he was a fine man, and he used to give the systematic lectures, of course.
Yes.
I'm sorry to say that it was sometimes a very noisy class. It probably wasn't fully appreciated. On the other hand, Jameson's class was a pretty silent one.
Yeah. It's amazing, isn't it, how people will walk in and immediately the class assesses them without any problems whatsoever.
It's extraordinary, isn't it?
Yes, first look.
Yeah.
Did you enjoy physiology?
I did, yes, I did. One of the difficulties was that we got so much anatomy in these days, so much detailed anatomy, that one felt one hadn't enough time to do justice to the physiology.
Yes.
But it was certainly a most interesting subject.
Yes.
I'm still interested in it.
What about biochemistry? Was that...
I found that quite difficult, to be quite honest.
Was this because your chemistry wasn't up to it?
Absolutely. Yes, absolutely. It was a completely new subject to me.
Had you done chemistry in first year?
Pardon?
Had you done chemistry in first year?
I think so. You know, my memory is beginning to desert me a wee bit. I think we did start it, yes, towards the end of the first year.
Do you remember who taught you biochemistry, or were they...
It was mostly a senior lecturer whose name, Steedman or Stedman?
Stedman, yes.
Stedman,
There was a Mr. and Mrs. Stedman, weren't they?
That's right. That's right.
Yes.
I remember being very... Yes, we did start chemistry in the first year, come to think of it. And I'll tell you why I remember that now. Because I was unfortunate enough to have developed chickenpox on the very first day I was supposed to attend university.
Oh dear.
And consequently, I was off for about 3 weeks. And when I turned up in the chemistry class, I was frightfully depressed because they were speaking in a strange language. You know, I just couldn't get a grip of this at all. It was dreadful.
Yes.
However, I made up the ground in due course. But I can still remember how depressing that first day was.
And you'd have no friends, would you?
No, I didn't know anybody there.
No, until you could say help. Yes.
But I quickly made friends, of course.
Yes. And did you make friends from the north, or were they...
No, they weren't really from the north. My best friend was another Edinburgh boy.
Right.
Sadly now deceased. And I was also very friendly with Alan Muir,
Right.
who I'm sure you'll remember.
Yes, yes.
And James Clark, the surgeon in Angus.
Right.
And a few more.
Was it mostly Scots in the class at that time, or were...
I suppose the majority were Scots, but there was a good English representation too.
Mm-hmm. Were they from overseas as well?
Yes, indeed.
Yes. Yes.
There was one chap from, I think it was Ghana, who rejoiced in the name. He was an African and rejoiced in the name of Henry Bannerman.
Oh, right.
I used to tease him about his name.
Yes, yes.
And he was another clansman. But,
yes.
He told me how he got that name, but I've just forgotten the story now.
Yes. And then you went through second MB to the preclinical subjects, like... how did you find Gadam?
Entertaining. He was a tremendously gifted man. He was also quite a good lecturer too. I quite enjoyed pharmacology.
Did you?
It was really quite interesting.
Yes.
Yes, it was a good class.
And did pathology and bacteriology have much impact on you? Or?
Bacteriology, I wasn't terribly keen on bacteriology, to be honest. But again, it was well done, Professor Mackey.
What was he like?
He gave very didactic lectures. Didn't see much of him at all, really, except for lectures. The man who subsequently became professor in Dundee, Jukard,
yes,
he was a lecturer.
Staphylococcus.
That's right, that's right. When I was a student.
Yes.
And one of the students, one of my friends actually, was Robert Gillis,
really?
Who became a professor of bacteriology,
yes,
as you know.
Because he had a very sharp wit, didn't he?
Oh, yes. He and Henry Bannerman were great friends, by the way.
Were they?
Yes.
Yes. What happened to Henry Barrowman?
I think he died a few years ago.
Right.
He went back, of course, to his own country. Evan Zantham was another chap on my year.
Right.
A very important man in Africa these days.
Right.
A vice-chancellor or something of his university over there.
Yes.
I always remember him as being a very good hockey player.
Right.
Evan Zantham. He was a very athletic man.
It's interesting, isn't it? A great man, and all you remember him about is a good hockey player.
That's right.
Yes. And then you moved into the clinical years.
Yes.
And which clinics were you on?
I was in Sir Derek Dunlop's,
right,
and Ray Gilchrist's,
right,
for medicine. I was in Patterson Brown's and Sir James Lerman's surgery.
Well, tell us about them. Tell us about Derek.
Derek.
Did you come across Derek in the college subsequently?
Pardon?
Did you come across Derek in the college subsequently?
Well, I was Derek's resident
right.
later on.
Right.
He was a marvellous man, a marvellous teacher. He was a great ladies' man, of course.
Yes, yes.
He always favoured the ladies in the clinic and asked them the easy questions, and the boys the difficult ones.
Yes.
Shall I tell you a little story about him?
Yes.
I remember years later, he asked me back to speak to his clinic about some respiratory condition. I think it was emphysema or something like that. And I arrived early, and I thought, well, I'll go in and see what the great man is doing now. It was the same drill, you know. He was taking them on a patient with anemia. And he always liked a simple answer to his question. He didn't like involved answers. And he asked this boy something about anemia, and he got a very involved answer. And he said, oh, dear me, who taught you that, boy? And the boy said, Sir Stanley Davidson, sir. And he said, oh dear, there are times when I feel ashamed of my old friend.
Yes.
Typical Derek story.
Yes. And what about the Gilk?
Gilchrist. He was an awe-inspiring character to the
Who did you have first, Derek or the Gilk?
Derek first.
Oh, you were lucky.
Yes. He was a very fine teacher, of course, Gilchrist, but he was formidable. I remember he would say to some unfortunate chap, now just put your stethoscope here. Now just put it here and here. Now tell me, what's the difference between the sounds you hear here and the ones you hear here? And this at a time when we could scarcely discern two sounds, let alone three or four.
Yes.
And he was very gifted though in his own way, and I learnt a lot in his clinic, as did all the others.
He wasn't a man consumed in doubts, was he?
He
was not a man consumed with doubts.
Oh no, absolutely not.
No.
Absolutely not.
Did he always have his ward sister with him?
Yes indeed, yes.
And the clinics were quite big in those days, weren't they?
They were, yes. That was a disadvantage in some ways, you know.
Safety in numbers in others.
Yeah, but there was a big congregation around the bed, you know, and it wasn't always possible or desirable, in fact, from the patient's point of view, that you should sort of try and elicit the signs that he was trying to demonstrate. So, yes, there's an advantage in smallness of numbers at times in the clinical setting.
Yes. Did teaching take place in all of the wards, or was it concentrated in certain?
Oh no, all the wards in the Royal Infirmary participated. Yeah. Oh yes.
What about Patterson Brown? What was he like?
Very much so. He was a very fine teacher.
Yes.
A very fine teacher. We didn't really see much of the surgery. I always felt it was rather a waste of time being taken into these operating theatres because you were so far away. Yes. You really couldn't see anything.
No, it was very boring.
Very boring. Yes. Yeah.
And likewise with Learmonth.
Yes, he was another awe-inspiring character.
Yes.
Rather sarcastic. Sometimes severe. A good teacher, good lecturer, but we could have done without some of his sarcasm.
I see. Yes. But Derek always came through as a very kind man, didn't he?
He was an extremely kind man, and very kind to his patients too.
Yes.
And very considerate.
Was Learmonth kind to his patients?
I think he was. Yes, I think he was. I think he reserved most of his nastiness, in inverted commas, for the students.
Yes.
He was very hard on students.
Yes. Was he hard on his staff?
Yes, could be. Yes, could be.
Yes.
Oh, yes.
Whereas there's an affection to Derek, and Stanley, isn't
there?
Yes,
yes.
Oh, yes.
Oh, and they earned it too. They were marvellous people.
Yes. Did you did your finals?
Yes.
And did you come across Crewe? Was he?
Professor Crewe?
Yes.
Yes, indeed.
What was he like?
He was a very good lecturer, most interesting lecturer. He was supposed to be Professor of Public Health, but he talked mostly about genetics.
Right. Yes. And were you there when the Polish Medical School was there?
Yes.
What was your impression of that?
I didn't really know many people in it. I knew Tomaszewski, of course.
Yes.
He was a good chap.
Yes.
And I knew one or two of the younger graduates.
Did you know Tomaszewski after the war, when he was a GP?
Oh, yes.
But you didn't know him when he was a reader in medicine during the...
No, not really.
Yes.
No.
They were very separate, were they? Did they?
Yes.
Right, right.
They had a place down at the Western.
Yes.
That was their headquarters.
Yes. And then you qualified and you did your house jobs where?
Well, my first house job was a house surgeon's job in Inverness.
Right.
With the late Hugh Miller, which was a good introduction to surgery. And of course, I then had to do my national service.
That was immediately after the one house job.
Yes, only allowed one job and then into the
And
army.
what year was this? This would be 48?
Yes, beginning of 48.
Yes. And what was it like? Was there a change in emphasis when the end of the war came? Did you suddenly feel relieved of this shadow that lay over the early years?
Oh, indeed, yes. But it would have been better, I think, from the doctor's point of view, had we been allowed to do, say, 2 house jobs before going into the army. But that wasn't allowed. And of course my army career was cut very short because I developed tuberculosis. I was diagnosed as having tuberculosis within a matter of weeks of joining.
Is that right?
So I was hospitalized for the next year.
So where did you join up?
I was posted to Salisbury Hospital.
Right.
But as I say, I was only there for just a few weeks.
And And where were you in hospital?
Tornadee, which was the officers' sanatorium near Aberdeen.
Gosh. So were you taken by train from Salisbury?
Yes. Well, I was in a military hospital for a very short time and then transferred up to...
Was that frightening?
It was, because you have to remember that in these days tuberculosis was an extremely serious disease.
Yes.
I was diagnosed more or less by chance. It so happened that in my very last year as a student, I had a pneumothorax. And I got a similar type of pain in my chest, and I thought, gosh, there's another pneumothorax. But the x-ray showed a small lesion in my right lung. And that was it.
Gosh.
And it was in some ways a bad time to develop tuberculosis, because it was just before the introduction of chemotherapy. And I had to suffer the horrors of an artificial pneumothorax, which fortunately failed.
Yes.
And a phrenic crush and pneumoperitoneum.
You had that?
Which were equally useless. And then streptomycin came along, and I had streptomycin alone.
Gosh. Single drug therapy
for 3 months.
But you retained your hearing?
But yes, more or less.
Yes, yes.
But the 3 months streptomycin alone did the trick.
How marvellous.
And of course that set me on my future career.
Yes. A bit like Christopher Clayson was persuaded that chest medicine was good for tuberculosis.
Well, it was actually Bobby Kears in Tornadee,
right,
who suggested that I should do tuberculosis.
Right.
And he fixed me up with a job in what was then a prestigious sanatorium in England called the Cheshire Joint Sanatorium,
right,
under Peter Edwards.
Right. Were there interesting people in the sanatorium in Tornadee? Where did you make friends?
Oh,
there?
yes. There were indeed. There was another doctor there, Donald McIntosh, who was a very fine chap. But they were taken from all professions, really.
Yes.
And it was a very interesting mixed group.
Yes. How did you spend the days there?
Well, the regime to begin with was very strict. I was on my back for about 4 or 5 months.
Oh, goodness.
And
how did you fill the day in?
Well, reading. Curiously enough, I thought, whilst I'm incarcerated like this, I'll study for my membership. But it was very difficult to do that, although I had all the time in the world.
Yes.
It was extremely difficult to do that, to concentrate. And I just read widely. Then afterwards, of course, one was allowed graduated exercise and all this sort of thing.
Right.
But it was quite a harrowing experience in some ways.
The only merit, presumably, was you were close to your parents, presumably. That
Yes, that was one advantage of being in Tornadee.
Yes,
that's
opposed
true.
to coming from Exeter or somewhere.
That's right.
Yes. Yes. Your parents must have been distressed at that time.
Well, my father was dead by this time, actually. Right. It was my mother.
Yes.
She was very distressed because she was fully aware of the reputation of tuberculosis.
But you survived with despite the medical attention.
Absolutely.
Yes. And then you went down to...
the Cheshire Joint.
And what was that like?
It was a very good teaching sanatorium. I learnt a great deal about
This was in Cheshire?
It was actually near Stoke-on-Trent.
Right.
Or between Stoke-on-Trent and Shrewsbury.
Right.
I learnt a great deal about tuberculosis there. And of course this was the obvious subject to offer as a selected subject in the Edinburgh membership,
Right.
which I duly did.
You could do TV as a separate...
Oh yes, indeed,
Oh, gosh.
indeed.
That was very visionary, wasn't it,
Yes.
in a way? Yes.
Yes.
Then what happened to you?
Well, then after the church I joined, I came up here as registrar to Professor Cameron.
Right.
Professor Charles Cameron. I was his last registrar.
Where was that?
That would be in 19...
No, where was that? Where was
at the Royal Victoria Hospital in Edinburgh.
How interesting. I've never heard of Charles Cameron.
Have you not?
No. Tell me about him.
Oh, yes.
Was he...
He was John Crofton's predecessor.
He came after Derek, did he?
No, Derek wasn't professor of tuberculosis.
Right.
Cameron was professor of tuberculosis.
And did he follow Sir Robert Phillips?
That's right. There was a long hiatus.
Right.
And Cameron was
I
appointed.
thought I'd heard of him. Tell me about him.
Oh, yes. He was a very cantankerous old man, I can tell you.
Was he?
Oh,
Where did
was.
he come from?
I'm not sure where he belonged. Oh, yes, indeed. Rothsey.
Right.
I remember him telling me in one of his better moments of his boyhood in Rothsey.
Right.
That was rather an amusing incident, actually. In these days, I was greatly troubled with hay fever, and I used to use antizan, antihistamine antizan, to try and control it. But of course, it made one sleepy.
Right.
And I remember one summer afternoon, I was particularly troubled, and just after lunch, I took an antizan tablet, not expecting the professor to come down, and of course he did. And he walked in, and there was the registrar, slumped in his chair, sound asleep. So he woke me up, and I thought, oh, I'm for it this time. But not so. He just laughed, and he sat down, and he chatted to me as he had never done before, and he was telling me about his boyhood in Rothsey, and he was altogether very charming. This a man who could be very fierce when he chose, you know.
Yes.
But there was a complete transformation. It was quite delightful.
Right.
He was a very erudite man. He was very, very well read, particularly, of course, in his own subject, but he read broadly as well. And he was a hard taskmaster, though.
Right.
Very hard taskmaster.
Was he right at the end of the pre-antibiotic treatment?
Yes, he was, yes.
And that it must have been a very curious time to be looking after tuberculosis, because in a way it was a glory of failure, wasn't it?
Yes.
A very structured failure in a way,
Yes,
wasn't
indeed.
it?
Mind you, it wasn't a complete failure, because I think there was some evidence that artificial pneumothorax, successfully induced and maintained, was of some value.
Right.
And of course the theory behind phrenic nerve crush and pneumoperitoneum was really just to inhibit the diaphragm on the affected side and thus rest the lung. And then there were other treatments,
Yes,
of course,
yes.
like surgery and thoracoplasty. Thoracoplasty was moderately successful.
Yes.
It was a dreadful, mutilating operation, of course,
Yes.
but it was successful in that it collapsed cavities and rendered the patient sputum negative,
Yes.
and therefore non-infective.
Yes.
So there was some rationale behind the treatments, although not to be compared with chemotherapy.
And so how long were you his registrar for?
Oh, until John Crofton came on the scene, which he did about, when would it be, about 953 or so. I'd have been about 2 years with
Was that a bit of a change?
oh, complete change, yes, complete change.
What was it like when he walked in?
Oh, he was a marvellous chap, he really was. He was so friendly, so approachable, and so very knowledgeable too. And so very modest with it all.
Yes. Yes.
A very modest
Great
man,
man,
John
isn't
Crofton.
he?
Very modest man, with great achievements behind him too.
And what happened when he came? What were the things that changed?
Well, there was a complete change of policy. Professor Cameron believed that we should concentrate on the early case of tuberculosis. Get the early case into the Royal Victoria, treat it with pneumothorax or pneumoperitoneum or whatever, and cure them as far as was possible.
And let the others die.
And isolate the advanced cases.
Yes.
As far as one could. John Crofton took the view that not enough was being done to isolate the advanced cases, and he said that the advanced cases should be housed or put into hospital whenever possible. As many advanced cases as possible should be in hospital in order to diminish the infective pool in the community. It's very good sense, of course.
Yes, yes.
And then chemotherapy was just coming in.
Right.
And he instituted all these trials.
Were you involved in those?
Oh, indeed, yes.
Were they interesting?
Oh, extremely interesting. One of the first things he did was to appoint a research bacteriologist, namely Sheila, second name escapes me, and Archie Wallace.
Right.
They were the bacteriologists, and they were the people who were going to work out the sensitivity tests and the resistance tests and so on.
And was that a novel idea?
Well, it was, yes. Oh, yes. And he was one of the first people to realize that tuberculosis needed multiple drug therapy.
Why did he decide that, do you think?
Because it was obvious that resistance was emerging through the use of drugs given on their own, like streptomycin or PAS.
Yes.
And this was becoming a big problem, or would become a very big problem.
Yes. Well, did you have a lot of problems with toxicity of these antibiotics?
Yes, the earlier streptomycin was, as you suggested earlier on, damaging to the ear.
Yes.
And to the
PS
kidney.
gave diarrhea, didn't it?
Indeed.
I mean, some people said they didn't feel unwell until they started the treatment.
That's right.
Yes.
It was rather unpleasant stuff.
Yes. But was it a time of excitement? Did you suddenly feel that...
Great excitement.
History?
Great excitement.
And yet you were digging a hole into your own career, weren't you?
Oh, absolutely. But you see, whereas before one treated patients for months without seeing very much tangible evidence for your efforts, when these drugs came on the scene, you literally saw a change in them, in the patients, within a matter of a week or two. It was marvellous. And particularly was this so with isoniazid.
Yes.
It was really quite stupendous.
Right.
And I never ceased later on to be telling students about this. You know, I'm sure they thought I was an awful fuddy-duddy, telling them about how marvellous this was, this drug revolution in the treatment of tuberculosis.
And it would be particularly poignant to you.
Oh, indeed.
Having just missed the chop yourself.
That's right. That's right.
Yes. Yes.
Yeah. Mm.
And then what happened?
Well,
by this time you'd got your membership by then.
Oh yes, I got the membership in 1953.
Yes.
John Crofton said to me before that, he said, "Now, if you get your membership, you'll become the chap in charge of the Edinburgh patients in East Fortune." Because there was an overflow. We had to send people out to East Fortune. I got the membership and he was as good as his word. I was a senior registrar first of all, and then I went to East Fortune as an assistant physician and looked after the Edinburgh patients there with Ian Ross as my consultant.
Right.
And we had a very enjoyable time there. Very interesting time. Mr. Logan and his team came down to operate on our patients.
How did you find him?
A formidable chap, Mr. Logan.
Wasn't it?
A very formidable chap.
The fact you call him Mr. Logan and not Andrew Logan,
yes.
in fact, indicates that,
yes.
doesn't it?
But he was a formidable chap. I used to assist him at times, and I remember once I wasn't able to assist him. I had to come up to Edinburgh for some particular reason, and I sent my SHO in to assist. And when I came back, I said to the SHO, "Well, John, how did you get on?" He said, "Oh dear," he said, "I thought you were my friend and so to speak." He said, "I got off to a very bad start." I said, "What happened, John?" He said, "I stood in the great man's foot." And he said, "I didn't know what to do." He said, I wondered if I should ease my foot off his, or if I should just pretend nothing happened." And he said, while I was making up my mind, he said, the great man spoke. And he said, "For God's sake, Bennett," he said, "I don't mind you standing my foot, but don't loiter there."
I think the funniest thing I saw with Andrew Logan was when he came to do the first lung transplant. I think it was Logan, the first lung transplant.
Oh, yeah.
And they were standing in front of this window with this poor lad who had taken one of these pesticides.
Mm-hmm.
And Gaelic-speaking boy, lost on his own, decided whether they were waiting to go into theatre. Would they transplant the left lung or the right lung? I mean, that was a sort of planning that went into it. So what happened then? You set up at East Fortune.
Yes, and after that, when the tuberculosis position became under better control, I came back to Edinburgh to work again in the Victoria with Ian Ross. And he unfortunately had a heart attack, was terribly ill, became dysphasic. But in spite of that, made a remarkable recovery and came back to work full time. And then we moved up to the city hospital. We got beds there. And, of course, the tuberculosis was virtually eradicated in Edinburgh by this time, talking now about 1960 or thereabouts.
Had bovine tuberculosis also gone? Had the tuberculin tested also?
Yes, the bovine. Of course, that had never been such a big problem.
No.
Certainly not in Edinburgh. It was, for instance, in Sutherlandshire, quite a big problem. There's a big bovine tuberculosis situation there, but not so in Edinburgh. And then it became obvious that I would need to change career.
And how did that come about? Did you have to decide that, or did suddenly someone John Crofton come to you and say, well, actually...
No, I more or less made the decision myself, actually. What happened was that consultant posts were no longer being advertised in tuberculosis, which I was trained for. They were more or less confined to chest medicine, for which I was only partially trained.
Right.
You see? And I realized that I was at a considerable disadvantage because of this. And although I had applied for a few consultant chest physician posts, I wasn't fortunate enough to get one, although I came close on a couple of occasions. And that decided me then that I'd got to make a change. And the obvious one was geriatric medicine, because this was then becoming quite a major specialty. And so it was I applied. And although I had had no previous experience or direct experience of geriatric medicine, I got a consultant post, the first attempt here in Edinburgh.
Based on which hospital?
On Longmore.
Longmore. Now,
and the Royal.
What was the setup in geriatrics at the time that you became consultant?
Well, really, there were only two consultants. There was Neil McMichael in Longmore.
Yes.
And Jimmy Williamson, then based at Southfield.
And was Jimmy Williamson a professor at that stage?
Oh, no.
Jimmy had also made this transition.
That's right. He'd made the transition earlier from chest medicine.
Yes. Now, what Neil McMichael had done how did he train? What was his background?
Well, he was really a private general practitioner.
Was he?
Yes.
I mean, he was a wonderful man, wasn't he?
Grand chap.
Wonderful
yes.
gentleman, and in the true sense of the word.
Oh, absolutely.
Tell us about him. Did you work with him?
Indeed, yes.
Because he lived just down the road from the Longmore, didn't he, towards King's Buildings?
Yes.
Yes.
Yes, I worked with him happily for quite a few years.
He must have been a great colleague to have.
Oh, yes. A man of great integrity.
Yeah. Did he ever get cross?
Oh, he could at times, yes. Oh, yes. But, no, by and large, he was a very even-tempered man.
Yes.
He was really the father of geriatric medicine in Edinburgh.
Right.
He it was who really started it. He started it all in Queensberry House, actually. And he turned Queensberry House from a poorhouse, literally a poorhouse, into a geriatric long-stay hospital. And, of course, the improvements came very gradually. It wasn't a popular subject at the time. There was no money put into it. And improvements came very, very slowly. But come they did.
And what sort of improvements were made? What were the things that were... What was the revolution?
Well, I think it was partly the demand by general practitioners for better services for the elderly.
Yes.
I think that's where the
impetus
came from.
But the change was what? What had been given pre Neil McMichael and pre you? Was it poor law medicine just chucked into a bin and left?
That's right, absolutely.
And tender care and...
There was no sorting out of the degrees of severity of impairments in old age.
Did you work out... did you have to work out a structure of... that was new? Did you?
Yes, entirely. Oh, yes. Yes, it was quite an exciting business, you know.
And was that the three of you, Jimmy, Neil, and you, or largely? Neil?
Cliff Lowther.
Yes.
He became a consultant with Jimmy, so there were then four of us.
Yes. Another clever man.
Another good chap.
Yes.
Oh, yes, a good chap.
Yes.
Yes, Tony Lowther.
Yes. And so you set up a grading system.
Yes, assessment.
Yes.
You know, we really looked at old people seriously.
Yes.
And found out what their disabilities really were.
Yes.
And what their residual capacity was.
Yes.
And how you could build on that to try and restore a degree of independence to them.
Right.
And it was remarkable how often one could do that, even with someone who appeared to be totally hopeless proposition.
Yes.
At first sight.
And the team that you built up, did that include social workers?
Yes, indeed. Social workers and physiotherapists and occupational therapists, speech therapists.
So this was the beginning of the concept of a team rather than the consultant as a isolate.
That's right. He was a member, but only a member of a team.
Yes.
An important member, but...
And so did you have to change the concept of a ward round?
Yes, oh yes.
How did you change that?
Well, what we used to do was we used to go over each case carefully in the doctor's room with all the staff there.
Yes.
Ward sister, physios, occupational therapists, so on. And each person was allowed to say, you know, they said what they thought should be done. And then usually the consultant summed up and decided just what was going to happen. then we went in.
Yeah, in the expectation that this could be challenged. That was the
Yes.
important thing,
Oh,
wasn't
indeed.
it?
Yes, indeed.
It wasn't...
Everybody had a say. Everybody was listened to very carefully.
yes.
And we tried to come to a sensible consensus.
Yes. Now, you drew your patients from the Royal, is that right?
I'm sorry?
You drew your patients from the Royal Infirmary, did you? Or were they
Oh, no,
direct-
from the community.
Right.
We took some from the Royal Infirmary too, of course, but
Yes.
our prime responsibility, as I saw it, was really to the community
Right.
in the first instance.
Yes. So did you do a lot of visits at home?
Oh, many, yes.
Right.
Yes. One had to do that, you see, because there was a shortage of beds, and you had to decide on which were the priority cases.
Yes.
It was a difficult thing to do because they all really had a degree of priority.
Yes.
It was really
yes.
a very difficult thing to do.
How did you start that? I mean, you had no experience of home visits,
No.
or did you in the tuberculosis day?
No.
Did you feel a bit...
I felt a bit lost to begin with,
Yes.
but Neil McMichael was very helpful.
And of course his general practitioner background
That's
would
right.
be...
It was very useful.
Yes. How interesting that
Yes.
one specialty moulded into another.
That's right.
So,
Yes. Neil was never really an orthodoxly trained hospital doctor,
no.
but yet he became one.
Yes. How did he get into geriatrics then? Did he just...
He just saw there was a need.
Right.
He saw there was a need. And as I say, a lot of other general practitioners recognised the need and prevailed upon him to do something.
Right.
And that was how he made his entry into Queensberry House.
Yes. Oh, right. And presumably you were in Longmore, you were working alongside Ronnie Robertson at that stage in general medicine, were you? Or
I'm sorry?
you were working alongside Ronnie Robertson in general medicine.
He was in the Longmore unit, yes, as the general physician,
Yes.
yes.
So that would have been another happy.
Oh, very happy.
Yes.
Ronnie was a personal friend, and it was a great help to us
Yes.
in Longmore.
Yes. Because he would presumably widen the base of...
That's right.
Yes.
Yeah.
And how did things develop then? I mean, did things just progress better and better?
Better
or?
and better. And then, of course, more consultants were appointed, and we had a very good geriatric service by the time that they were all in place.
Yes.
It was quite a comprehensive service.
And when did you begin to... Did Jimmy Williamson have an influence on you, or did you feel that you were developing something alongside what Jimmy was doing?
Yes, I think alongside, yes. Yes. Jimmy, of course, left us for a wee while. He became professor of geriatric medicine in Liverpool.
Oh, right.
And then he came back
That's
to the
right.
chair in Edinburgh.
Yes, 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 yes. That's such a good story, that, because, I mean, it's one of the strong developments in Edinburgh,
Yes.
isn't it? And
Oh, yes.
was geriatric medicine largely developed by chest physicians who had moved into geriatric medicine?
Yes, I think that's possibly true. In the beginning, that's to say. Of course, later on, young men came in from choice.
Yes, but did you feel that your training in tuberculosis gave you a background in a... I mean, because if you like, old age is a chronic debilitating condition, isn't it?
Yeah.
Were there things in the logic and the care of tuberculosis which, whilst not being absolutely the same, because old age isn't infective, it's contagious,
Yes, the sense of follow-up and the social aspects of tuberculosis were relevant to geriatric medicine too.
Yes.
Oh, definitely.
Did you carry sisters across with you? Were the nursing staff translated, or were they
No.
totally new nursing staff?
New nursing staff.
Yes. Just to go back to the tuberculosis, was it difficult in the Royal Victoria for the nurses, when the regimes changed? Was it difficult when the chemotherapy arrived in tuberculosis for the nurses to cope, or did they take to it like a duck to water?
Oh no, they took to it like a duck to water. They really did.
Right.
They were very excited too, of course.
Were they? Yes, yes.
Because it was such a transformation in the situation.
Were the great nurses who you worked with?
Oh yes,
What sort of?
Splendid people.
Yes.
Splendid.
At the Royal Vic, what sort of? Do you remember people?
Oh yes, Miss Melrose and Miss Williamson, now Mrs. Gow, who went on to become the matron in the Victoria with Jimmy Williamson.
Right.
She was one of my ward sisters at one time. Oh yes, there were some very fine people.
Yes, yes.
Mary Ferguson was another one. Many first-class nurses.
Yes. And then when did you start getting involved in the college?
Well, that came about in 1968.
Prior to that, you'd set the membership and...
Very little connection with the college until then.
Yes.
Yeah.
Can we have a break there? Can I have a break there? I need
yes.
I need a pee, actually. So, 1968, you became involved in the college, and the president at the time was Christopher Clayson.
That's right, yes.
You came in as registrar, did you?
I did, yes.
And how did you find the college? What was it like? I mean, there's been such a transition in the time that you were registrar.
Yes.
What was the college like when you came in 1968?
Well, the college was rather an exclusive club for Edinburgh-based fellows. And really, fellows out with Edinburgh had very little to do with it. And members had nothing at all to do with it. I'm sure you must remember yourself, Martin, that as a member, you really didn't have much involvement with the college.
No.
Perhaps attending the odd lecture, but not much more than that. And so it was. I think during my term of office, from 1968 to 81, the two most important things that happened were, first of all, the opening out of the college to its own fellows outside Edinburgh, and also the involvement of the members in the college. And secondly, an intercollegiate coming together of the three colleges. Right. Stimulated, of course, by the development of the MRCP UK.
Yeah.
So these were the two major events, I would say.
How did you came in and you ran the exam?
That's right.
What was the exam like? What was the format of the exam in 1968 when you were first involved?
Well, it was very different, of course, to the present setup. There were 6 hurdles to the membership examination. There was a written paper in general medicine and a clinical and oral in general medicine, a written paper in the selected subject, and a clinical and oral in the selected subject. 6 hurdles in all. And now, as you know, it's reduced to a written paper and a clinical and oral in general medicine, and no selected subject.
Were there large numbers sitting the exam in 68?
Yes, there were, but curiously enough, from about 1964 to 68, the numbers sitting the exam in Edinburgh were actually falling. Not dramatically, but definitely falling. And a lot of reasons have been put forward for this. Among them, the fact that down in England, there were many more courses open to foreign students. Whereas, of course, we had the one internal medicine course here. And also it was said, and I think correctly, that perhaps the courses given down south were more relevant from the foreign graduates' point of view, in that they were more clinically orientated. Ours, as you know, was just a sort of lecture course. That was all there was to it. And again, I suppose some of the candidates have realized that 6 hurdles are more difficult than 3.
Yes.
So there were a number of reasons why the number should be following.
Were you involved in the membership course, that 6-week, that prolonged lecture course at the Lister Institute? Was that part of your remit?
Yes, they used to come for the odd clinical demonstration to us, but that was about all.
Right. So you took on the exam. Was that your predecessor was?
Willie MacLeod.
Willie MacLeod.
Yeah.
Tell us about Willie MacLeod.
Oh, he was an amusing character. He was very versatile chap. A Gaelic speaker, by the way.
Yes.
From Stornoway. He was a very amusing man. Very capable. Very good registrar, and also subsequently a very good treasurer. And in fact, he was treasurer on 2 occasions. So he was quite a lad of parts, was our Willie. Oh, yeah.
Very kind, gentle man, wasn't he?
Very.
Yes.
Friendly man.
Yes, always came and there was a sort of hug and a thing,
Yes.
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 And you were lucky in that you came into Christopher Clayson
Yes.
as president.
Yes, he was a marvellous chap.
Yes.
He was a very charming, beautifully mannered, erudite man. Marvellous after-dinner speaker.
Yes.
In fact, I don't think I've heard a better one.
Right.
He was really very, very good. But he was more than that. He was also a very skillful negotiator and planner, as his efforts for the Common Part 1 demonstrated so very clearly.
Right.
And he also, of course, laid the foundations for the introduction of the Common Part 2 exam.
Right.
He did a great deal of work for the membership.
How did the initiative for that come about? Who introduced that concept?
Well, I suppose there were a number of reasons, but we ourselves had a Part 1 exam here in Edinburgh starting in 1965.
Right.
It was a large number of questions that required brief answers, but it really was not a success. It really wasn't a success.
I remember sitting the second of them and you knew exactly what was coming.
Yes.
The optic nerve was a sit. There were 20 questions, weren't there?
Yes, that's right.
The optic nerve, you knew that could not fail to turn up. Well, that meant there were only 19 left, and that was 5 marks.
Yes. Well, it was an attempt, I suppose, to reduce the number of ill-prepared candidates.
And did it at all?
But I don't think it did, actually. And about the same time, the London College had introduced an MCQ Part 1 of their own, which appeared to be a success. So, and Glasgow, I can't remember what was happening in Glasgow. I don't remember if they had a Part 1 of their own or not. But anyway, Edinburgh and Glasgow decided to approach the London College with a view to having a common Part 1. And, of course, this eventually came about.
Right.
After a good deal of discussion and negotiation.
Was Max Rosenberg involved in this?
Max Rosenheim.
Hein, yes.
Yes. Max Rosenheim was the London president at that time. He was a truly marvellous man.
Yes.
A giant of a man. An intellectual giant. and yet a very humble man, very friendly man,
Yes.
and a great friend of the Scottish colleges.
Yes. He also became a great friend of Christopher Clayson's, didn't he?
He did indeed, and John Croom's.
Right. Yes.
Oh yes, Max Rosenheim was a truly marvellous man.
Yes.
And it was very generous of him that he didn't in any way take advantage, the obvious advantage that the London College had in these negotiations.
Right.
I mean, London was a point of entry for all of these foreign graduates.
Yes.
They had all these centres of instruction. You know, he could so easily have exploited that to the London advantage, but he didn't.
Isn't that marvellous?
He was a marvellous man.
Yes. Did you have an opposite number as a registrar?
Yes.
Who was that?
Sir Ken Robson.
Right.
Another Scotsman, actually.
That's lucky, isn't it?
Yes. He was a fine chap, too.
Yes. And that's when you negotiated the...
Yes.
Right. Right. So that was... So you cut your teeth, in a way, very early on the introduction of the Part 1.
Well, no, not quite. The Part 1 had actually been introduced just months before I became registrar.
Right.
It was introduced in October 68, and I became registrar in December.
Right.
But Willie must have seen the difficulties coming and got out.
But what were the difficulties?
Well, there were many, you know. It seems strange looking back on it now, but a lot of the fellows, you know, were very suspicious of these developments. The hallowed Edinburgh membership, instituted in 1881 or wherever it was, whenever it was. I think it was about then, actually.
Yes.
1881. Greatly lauded throughout the world. Very popular. Is this big London college going to swamp us and take us over? Are we going to be an offshoot of London? This was a sort of thinking among many of the fellows. And then, of course, that was a good deal of nostalgia. It was largely nostalgia. But there were also some more serious arguments, like an examination with a selected subject gives a candidate an interest to aim at. A postgraduate who has had a lot of experience in specialty is more likely to get credit for it in an exam that has a selected subject. Young doctors aiming for their general professional training cannot all be absorbed into medical units. There are not enough of them. So perforce, many of them will have to train, at least for part of the time, in specialized units. Would they not get better consideration in an examination that had a selected subject?
Yes.
You know,
yes.
There were quite a few arguments. But I should say, too, at this stage, I think, that Christopher Clayson had the great foresight to set up the Advisory Committee on Examinations, with Henry Matthew as the first chairman and myself as the secretary. And we had a very strong membership at that time. We had Michael Matthews, Ronnie Robertson, and Henry Walton, and John Richmond, all very able chaps on this advisory committee. And this became a very influential body on all matters pertaining to the exam and indeed to the strategies to be adopted for the Part 2. So that was another very good thing that Christopher Clayson did.
The other big movement that was happening at that time was the Croom Committee, wasn't it?
Yes, yeah.
Because that brought in the concept of collegiate membership.
Well, yes, indeed.
And
now that was an important thing. Indeed it was. John Croom, of course, followed on Christopher. That would be in 1970. And he was very different in style, of course, from Christopher. John Croom was a sort of typical Edinburgh consultant physician, general physician of the time, a very good one too. He was a pillar of the medical establishment here, with an impeccable pedigree, a father who was a distinguished private general practitioner in the city, a grandfather who was a very distinguished gynecologist, I think he was, who was actually knighted for his services.
Yes.
So he had a very fine pedigree. I think John Croom was a far-seeing man, you know. He realised that members weren't given the fair crack of the whip in the college, and he wanted to further their interests. And the way he did it was by sponsoring the collegiate membership. And isn't it very fitting that today one of the highlights of the collegiate members symposium is in fact the Croom lecture?
Absolutely.
I think it's so nice that it has happened this way.
Yes.
And I seem to remember that a young Martin Eastwood was the first chairman of the collegiate members committee.
And set up the Croom lecture.
Isn't that right?
Yes.
Yeah.
Yes.
Yeah. So John Croom did that great service for members and for the college, because he not only set up their committee, but he also ensured that they participated in every important committee in the college,
Yes.
apart from the fellowship one.
Yes.
So that was a wonderful thing he did. The other great thing was, of course, that he was responsible for finalising the negotiations for the Part 2, the Common Part 2 exam. And as I think we mentioned before, he was a great friend of Max Rosenheim, later Lord Rosenheim. I think they met in the Middle East during their war service, and they were great friends ever since. And I'm sure that helped the negotiations along.
Yes. It's curious how the war had long-term effects in terms of friendships.
Indeed, yes.
Breaking down these
That's right.
barriers that
Yes.
had set up, wasn't
Yes.
there, communications.
Yes.
Yes, Lord Rosenheim was an interesting man. I think he was he not a bachelor?
He
Looked
was.
after by his sister.
That's right.
Yes.
And it was quite interesting, you know, at that particular time, the London College was run by 3 bachelors.
Right.
Yes, the president, the treasurer, and the secretary, and the registrar.
Was Lord Cohen one of those? Or was
Pardon?
Lord Cohen, was he?
No, I can't remember the treasurer's name offhand just now, but of course Ken Robson was
Yes,
the
how
registrar.
interesting.
But the 3 of them were all bachelors.
Yes.
They were married to the college, in fact.
With the start of the Common Part 2 exam, did you feel that the college had inextricably changed?
Certainly changed insofar as the selected subject had to be dropped. There was no possibility of that continuing. But the new exam really was a very attractive one. And when the London Review was made in 1970, recommending that essay questions be abandoned in favour of a written paper comprising problem-solving case histories and data interpretation and clinical photographs. This seemed to us in ACOE to be exactly the right thing to do.
Yes.
And we strongly recommended it to the council, and the council had no difficulty in accepting that, although there was some difficulty, as I think I suggested earlier, amongst fellows accepting it. But eventually it was accepted.
How often did the ACOE meet?
About every month.
Gosh.
Yeah.
And was one of the functions of that was it mostly mechanistic, or was there a lot of work on setting up questions and...
Oh no, we had nothing to do with setting up the questions.
Yes.
No, once the acceptance of the exam was obtained from the college, then examining boards were set up for both parts, right, with representatives from all three colleges,
right,
to work up question banks.
And what was your involvement during this transition? What was your job?
Well, my job was to implement all the arrangements for the exam, to accompany the president to London to negotiate the conditions of entry and so on.
And so that you had the actual content of the exam being arranged by these boards?
Yes.
So your role was that of the supervision of the actual exam itself?
Supervision of the exam itself, yes.
Were there implications in the sites of where you had the exams? Because originally the membership took place largely in the Royal Infirmary, didn't it?
Yes.
What happened thereafter?
Well, there was a need to bring more units into the examining process. And I remember one of the first things that occurred to me was that we would have to involve examiners from south of the border, Edinburgh fellows south of the border. And when I first suggested this, I was regarded as something of a revolutionary. This chap is really going to cost the college an awful lot of money, you know. But it seemed to me the only way to do it. And also, it was a way of involving fellows out with Edinburgh who hadn't been involved hitherto. And the president of the day, John Croom, was all in favour of this, and so it was eventually accepted that I was given permission to invite people from faraway places to come and examine. It all sounds so strange now in view of the fact that they come from all the Alps to examine in the college. Yes. But in these days it was something of a revolution.
The extraordinary thing about John Croom was that he looked such a establishment man, didn't he?
Yes.
Immaculately dressed, he always had a coloured handkerchief
hanging
out. So it always had a nice wilt to it.
Yeah.
And his moustache, which was very carefully gardened and groomed and looked after. And yet he was, for such an establishment man, he was so receptive to change, wasn't
Absolutely, he? Yes.
He was not the initiator of change, was he? But he would seize on it. And
That's right.
He was a great sieve of information. I mean, the thing that I remember about meeting him when I was chairman of the collegiate members was him meeting on a weekly basis or fortnightly, and he would enormous gin and tonic.
Mm-hmm.
And he would always say, I'm just a tiny little bit diabetic, Martin, so he'd fill it 3/4 full of gin and 1/4 full of tonic in order to keep the blood glucose under control.
Yeah.
So by the time that John Croom presidency had finished, the exam was now established in its new format, was it?
Almost. Not quite.
What still remained to be?
Pediatrics.
Right.
Pediatrics was still a problem. And in fact, the solution to that didn't come until 1977, 5 years later. And from 1972 right up until 77, the candidates in pediatrics had a very big component of adult medicine. In fact, they did the same written paper as the candidates in adult medicine. An analysis in 74 showed that they were doing significantly less well than the candidates who were having clinicals and orals in general medicine. And so the joint committee of the three colleges recommended that there should be a separate written paper in pediatrics, on the same lines, really, as the one for general medicine.
Right. Did that take a lot of... of setting up, or did you set up another board which
Or
facilitated?
there had to be another paediatric board for that, yes.
Were the boards interesting? Did you find them exciting?
Oh, yes. And we in ACOE got the minutes of these boards and picked out the points of interest to pass on to the council with comments.
Right. And of course it was a very intelligent group of men that you had in there. Yes.
Oh, yes.
Then, what happened then? The John Croom then became John Crofton.
John Crofton, yes.
Yes. Now, he was your own boss, wasn't
That's
he?
right. I knew him very well, of course, from
Yes.
our days in tuberculosis medicine. And he brought the same qualities to bear on the college affairs as he did in tuberculosis. You know, that vigour and drive and organisational ability. He had tremendous organisational ability, Crofton.
Was that a quiet time for the exam because this was
Relatively quiet time, yes.
because this was the period of the start of the conference centre and, if you like, the expansion of the college in other ways.
Yeah.
Did you feel that the major revolution had passed by the examination and you were now into automatic drive into some extent?
Yes. Oh, yes. The pressure had definitely lessened.
Yes.
It was a very anxious time up until then.
Yes.
But the pressure had definitely decreased by then.
What had happened to the numbers coming to Edinburgh as a consequence of the common exam?
Well, maybe I should mention that the MRCP UK designation was introduced in October 1969.
Right.
But the colleges, the three colleges, pursued their separate examinations right up until 1972.
Right.
Edinburgh still had its selected subject from 69 to 72. And one of the first observations we made in ACOE was that the numbers entering our exam in Edinburgh, our Part 2 in Edinburgh, fell quite dramatically over the first three exams. In fact, London had 4 times as many candidates as we did.
Right.
And indeed, Glasgow was catching up on us.
Right.
Glasgow were nowhere in the past as regards numbers, but they were fast creeping up on us. And of course, the reason for it was that we had 6 hurdles.
Right.
And the others had only 3.
And then, so that John Crofton's presidency was a admiring presidency as far as you were concerned, right? Were there trips to London?
Yes, there were still meetings of the intercollegiate committee, and I always accompanied the president.
Yes.
And he was usually briefed beforehand.
Yes.
On points concerning the membership from either Henry or myself. And sometimes he came to we often organised a meeting just before the intercollegiate meeting at which the president would attend.
Right.
And he was fully briefed on our views about the membership exam.
Right. What happened on those trips? What was the format? Did you go down and back in one day, or was it?
Usually, yes.
Right.
Yes, usually.
Right.
Had lunch in the college. It was an early start to the meeting.
Yes.
And had lunch and usually broke up about 2 or 3 o'clock.
During this period was the introduction of college managers, was that?
Yes.
So how did that affect you?
Not a lot, to be honest. The college manager was really superintending the secretarial staff, and I think his duties have now greatly changed. Yes. But in the beginning, he was just a sort of superintendent of college administrative staff.
Did the college officer impinge on you?
Not a lot.
No. How did you, during this time of the evolving exam, were relationships with the clinical units important, or was it taken for granted that the exam inexorably moved on and that there was always... I mean, did you have to negotiate considerably over the exam.
Oh yes, yes. And particularly with the Royal Infirmary, because the Royal Infirmary, I suppose, really was overused for examination purposes. It was not only the membership they had to cope with, but also the finals and various other bits and pieces of exams. And it was very necessary to give them a bit of a rest and involve more units. And that was one of the principal reasons for organising the exam out with Edinburgh. I mean, in Dundee and Inverness and Aberdeen and the borders and so on.
How did you monitor that? How did you keep a control on that the exam was going to have the same standard as set by the Royal
I went to many of these places myself,
right,
to see what was going on. And, of course, they were all very well-known fellows of the college and very keen.
But quite innocent in the vagaries of the membership exam, though? Or did they come to Edinburgh and examine first before they
Oh, yes. Oh, definitely.
This must have been quite telling on your clinical practice, though, mustn't it? I mean, if you were making trips away, or were they sufficiently infrequent as to not make your clinical work difficult?
Oh, no, they weren't so frequent as to do that.
No. And then what happened with the membership exam during the coming up into the late 70s and the 80s? Did it remain as a steady?
It did. There were little changes made here and there, particularly in the conduct of the examination and the introduction of more examiners. There were also changes in the regulations. Perhaps the most important change, in fact, was the introduction in 1981 of the written test as a screen for the clinical, so that only people who were really pretty well prepared came through to the final adjudication.
Part of the examination work was the counselling of people who had failed.
Yes.
Now, did that change over the period that you were registrar? Did the type of candidate who you were talking to in 1970, was that person different from the one in 1980 in the type of things that you were having to counsel on, or was it the same problems? Ill-trained, ill-worked and ill...
Yes, and I think in the early days the most outstanding problem was that many of these candidates had unsuitable jobs to prepare themselves for the membership. And things seemed to get better as the years went on. And the number of really bad failures, really atrocious failures, reduced.
Right. Do you think that there was a change also in the background, the countries that people came from as well, wasn't there? I mean, less Australians, less New Zealanders,
yes.
And a change in the Indian
That's right.
and Pakistani.
Yes. Mm-hmm.
Were the Indian subcontinent candidates, were they getting better?
I thought so, yes, I thought so.
Yes.
Yes.
As the things improved in India.
Yes, I think so.
Yes. And then the next president that you worked under was Ronnie Robertson.
Ronnie Robertson, yes. He was a marvellous chap too. He, like John Croom, he was immersed in college affairs, having been secretary and registrar. How he combined both jobs as he did, I don't know. Because certainly one job was quite enough for me, but he did. And of course he was a prominent member of almost every committee in the college and chairman of some of them. And the one I remember best is he was chairman of the laws committee for many, many years. I was on that committee myself for a few years, and I must say I found it a bit tiresome But Ronnie revelled in it. He absolutely revelled in it. And of course his great forte was meticulous attention to detail.
Yes.
Enormous attention to detail. I often thought that if he hadn't chosen medicine as a career, he'd have made a marvellous lawyer. But anyway, he prepared all his stuff so carefully that the rest of us in the Laws Committee had only really to approve of his recommendations. There actually was a lawyer on that committee, of course. No, it was the present clerk's father,
yes,
Alec MacLeod.
Yes.
But Alec had very little to do, when Ronnie was in command.
Yes.
It really was an astonishing performance. But he was a marvellous chap. He was a most amiable and hospitable and a very dear friend. He really was. I was terribly saddened when first his dear wife Dorothy died, and not so very long afterwards Ronnie himself. They were very good friends.
Yes.
A great loss to the college.
Yes. But I think the thing that really put the nail into him was the loss of his daughter, wasn't it?
Yes, Muriel, yes.
I mean, that started things.
It
lost some of the fun of life.
Absolutely.
Yes.
This was something in a way that we shared in common, because I lost my son at a very early age too.
Yes.
And it was a sort of bond,
Yes.
Terrible thing to lose a child,
It's
devastating.
An adult child is a loss forever, isn't it?
Oh yes, devastating.
Yes.
Oh yes, Ronnie was he was a grandchild. He was also a very good speaker, if you remember.
Yes, very quirky speaker, wasn't he?
Yeah, that sort of canny way he had, and he told his funny stories, of which he had a great store, with great skill and perfect timing.
Yes.
That was the hallmark, perfect timing.
Yes, yes. I believe that when he was president, the council meetings went on perhaps longer than they did under Joe Crew.
That's right, yes. Oh, indeed they did.
Yes. And then I think the thing that always interesting to me about Ronnie Robertson was when he was not the chairman, he was a devastating person to have on the committee, because he would whip in with a summary just before the chairman. So the chairman had nothing to do but to agree with Ronnie Robertson.
That's right. Absolutely.
So you couldn't win with him,
No.
but he was done in such a beautiful way that... And then you came into John Strong's presidency.
Yes, the first 2 years of John Strong. John, of course, was an academic of high intellectual distinction. But unlike the popular concept of an academic, he was also quite a practical man.
Yes.
He was a good, sound, practical man. And of course he had enormous responsibility for the tercentenary celebrations, which were such a success, and in no large measure due to him.
Yes.
And he was also involved at the very early beginnings of the plans for the conference centre.
Yes.
And for the funding of it. 2 very big projects,
Yes.
which for which he deserves a great deal of credit. He wasn't a great speaker, curiously enough. Surprising that.
Yes.
He didn't like public speaking. What he said, the little he said very well.
Yes. Yes.
But not particularly amusingly.
No.
Shall I tell you a little funny story about him?
Yes.
Well, John Strong and the late Clifford Maudsley and myself had to go down to one of these intercollegiate meetings in London. We went down overnight on the sleeper, had breakfast in the Great Northern, and as I remember, it was a nice spring morning, And John Strong said, let's walk up to the colours. And walking up to the colours meant that going up that gradual incline for about a couple of miles, right up to Regent's Park, you know, quite an incline. Now, John Strong was a very tall chap, and he takes long strides, as you know. And Cliff and I, by comparison, were little chaps. Yeah. And we were half running by the time John Strong started off. And halfway up Euston Road, Cliff was sort of pecking away behind me. And he said, oh, Hugh, he said, I'm going to give up. He said, I just can't keep up with this damn policeman.
What was Clifford Maudsley like to work with?
Oh, he was a delightful chap, Cliff. He was very amusing, very opinionated, of course. You know, very, very opinionated. But he was usually right. I liked Cliff enormously, and was very saddened when he died. He was a good servant to the college too.
So, you worked with whom as secretary? Who were the secretary? There was
Alec Kay was the first one,
yes,
and then James Syme.
Yes.
Then
how did you find working with James?
James was fine.
Yes.
A sort of enigmatic character,
yes,
but a good chap.
Very good, yes.
David Boyd, good, slightly aloof, you know.
Yes.
Reserved, very reserved.
Yes.
But good secretary.
Yes.
And Cliff.
Yes.
The inimitable Cliff.
Yes, he always had a bounce about him, didn't he? That
yes.
A few other people. Did you miss the college when you finished being registrar? Did you miss the...
I did in a way, yes, but I realised that I'd done my stint, and it was... I continued, of course, with ACOE. I was chairman of ACOE from 1980 to 89.
Right.
And I enjoyed that. I was fortunate because I had some very good fellows with me.
Who did you have working with you?
John Anderton.
Yes.
And James Syme, and Tom Chalmers, and Ed Housley.
Yes.
So three of us were ex-registrars, and John Nimmo, in fact, was the current registrar. So we had a lot of examination experience between us.
Yes.
And we got on with the work of ACOE quite...
There must have been a lot of friends there as well, people who were... Did you find that was the most important thing about the college, the fellowship of
yes. We had a lot of friends.
Yes.
It was marvellous from that point of view.
Yes.
Marvellous. And you met so many interesting people too from other colleges.
Yes. When you were chairman of ACOE, did that mean contact with the London colleges or...
No, we reported directly to the council.
Right.
We got all the Part 1 and Part 2 examining board reports.
Yes.
And we picked out what was important in these and passed on our views on these to the council. And we also considered the composition of the examination panels.
Yes.
We considered the suitability of new chaps proposed for the various examination panels. We received proposals for new diplomas and certificates, some of which we approved, others we didn't. Among the ones we approved were, for example, the diploma in pharmaceutical medicine, which was a great success, and the certificate of blood transfusion. And we rejected a few others that didn't seem to match up. There was one proposed in my own subject, geriatric medicine. Didn't seem any point to it because there already was one established in London.
Right.
And there was another one proposed in, I think it was dermatology and nuclear medicine and epidemiology. There were quite a few that didn't see much point to at that stage.
What were your criteria for deciding that something was worthwhile as opposed to that it was...
Well, the need, primarily the need, and whether we could justifiably set this up under the auspices of the Edinburgh College, or whether it would require to be a joint effort among the three colleges, and that would obviously need the participation of these sister colleges.
Do you feel that in that respect the college had lost its independence, or its ability to act independently?
Slightly.
Yes.
But I don't think that was too serious a penalty, really.
No. Are there things that we've missed in... are there things that we have missed in...
I don't think so. I think we've covered the ground fairly comprehensively as far as I could illustrate it. I think so.
Good.